Good evening, everybody. I'm Sayukta, your host for today's live from All About Skin Allergy team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in our lives. Urticaria is characterized by round rash on the skin that itch a lot. It may be due to chemicals in certain foods, allergy to certain medication, insect stains, sunlight, and sometimes the cause is unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it. And doing self medication can actually worsen these symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's of course a boon and blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, kind of test required for its diagnosis, the right treatment and management approach for an early relief. So today we have with us renowned dermatologist Dr. SENTHIL SIVAPRAKASAM, live from Chennai. Dr. SENTHIL SIVAPRAKASAM is a dermatologist, aesthetic dermatologist, and cosmetologist in Chennai and has an experience of 17 plus years in this field. Dr. Sivaprakasam practices at Radiance Skin and Hair Care in Kilpauk, Chennai. He has completed his MBBS from Sri Ramachandra University, Chennai in 2005 and MD Dermatology from Meenakshi University in 2013. He is also a member of Indian Association of Dermatologists, Venereologists and Leprologists, IADVL, and American Academy of Aesthetic Medicines. Some of the services provided by the doctor are partial hair additions, glycolic peel, thread lift, lip augmentation, and medical vitiligo treatment, etc. A very warm welcome to you, doctor. Hope you are doing good, sir.
Thank you. I'm doing good.
Okay, it's a pleasure to have you with us. And today, as we are going to discuss urticaria and its management, first of all, we would like to understand, doctor, what is urticaria?
Okay. So urticaria is basically an allergic reaction where the patients normally complain of, sensation of itch or redness or a wheal on the skin. And normally the most common thing is that they start feeling this in the evenings. It can happen throughout the day, but it's very common in the evening time, particularly when, somebody is more relaxed and free, when the mind is not thinking about anything else. That's when these start showing up. They feel a light itch. Once they itch, they start feeling small bumps or wheals which start developing everywhere, which we commonly call as hives. And that's how it starts.
Okay. We would also like to understand, doctor, as urticaria, we are saying is quite common and almost everybody, experience it once in a lifetime. Now, normally, skin allergies are common and people do get skin allergies. What my question is that how we can differentiate urticaria from the other skin allergies? What I mean to ask you is, what are the characteristics of urticaria? How does it look like?
Yeah. See, the most common thing to differentiate a urticaria from another allergy is that in urticaria, the rashes will appear and disappear by themselves, even without treatment. But in other rash allergies, the rashes do not disappear by itself. You need to, take some treatment to make sure that the rashes disappear. Here, what the patients normally tell is that they see the rashes or hives come up, and then within the next couple of hours, they disappear even without treatment, and then they come up in a new place. So this disappearance of rashes without treatment is what signifies urticaria or differentiates urticaria from the other common allergies.
Okay, right, doctor. And doctor, what causes urticaria? What are the main causes?
See, the most common is normally when you is like food allergies or sometimes medicines which don't suit someone if they take those medicines, or dust or animal dander or pollen from the plants, flowers. So these are the most common things. But then if you take studies which say that 85% to 90% of urticaria is idiopathic, in which means basically there is no reason for the urticaria to develop. only 10 to 15% is due to food or drugs, medicines, or chemicals. So there is nothing that you can really say urticaria is because of this or because of that. But then it can happen even without any reason in a lot of people. It starts suddenly, and then sometimes it even disappears by itself.
Right. So most of the time, the reason is unknown or there is no reason. It
Yes,
just happens.
yes,
What I also would like to understand, doctor, is that one thing is sure about urticaria is that it itch a lot, right? So it comes with a lot of discomfort, irritation, etc., to the person who's having these urticarial rashes. But is it anyway a serious condition? I mean, can urticaria be life-threatening or anything more serious?
mostly it is nothing to it's known as angioedema, where it can actually cause swelling of your airways, breathing airways. So when
Mhm.
that happens, the airflow to the lungs is restricted, and that is when it becomes very dangerous to the patients. So if someone notices that urticaria is causing something similar to that in the past, they need to be very careful with urticaria. But other than 99.9% of the patients will almost always have it on the skin, where it is nothing to worry. It is very safe. They do not get worried. Just a normal medication will be more than enough to treat it.
Right. So urticaria becoming a serious, concern is the chances are very rare, but still we
Very
need
rare.
to be very careful because,
Yes.
anyways, it causes a lot of discomfort. Now,
Yes.
doctor, the thing is that a person is definitely, I mean, because they are itchy, right? So it do brings a lot of discomfort for the person who's having these urticarial rashes. Now, most of the time, people suffer in silence. They don't come up, they don't go to the doctor. Uh, Foremost, what they will do is to go to the chemist and ask for an anti-allergent and have it and relax. What do you suggest? What is the right way of treating, or is there any importance of being concerned about these arterial rashes?
Yes. See, the first thing is even any anti-allergy medicine that the patients take from a pharmacist will also give some relief. But the main problem is that it's not going to be long lasting. So they take it for a couple of days, they'll be normal. Once they stop the medicine, again the rashes are going to appear again. So once this cycle goes on say, a couple of times, that's when most of the patients will come to the doctor. They don't come in the first place. So what happens is once they come, we need to do a workup of all the blood investigations to check the allergy levels, like the IgE levels and other things, which are normally raised in a patient with urticaria. And
Mhm.
then we start them on medications based on the symptoms and the levels of the blood parameters. And the other main issue that I normally see with patients is that when most of these patients go to the pharmacist and get the medicines, a lot of them are being given steroid medications, oral tablets, steroid tablets to give a good relief. But the problem
Right.
is that it's not permanent and it can have a lot of side effects. So it's always better to meet a dermatologist and start the treatment.
Exactly. Of course, a chemist, won't tell you or won't treat you as a doctor because he or she is not a doctor. So you need to go and consult a right person. That's a qualified dermatologist in case of urticaria. Many people, again, are there who go for home remedies. They feel that, okay, I'm having these urticarial rashes or hives. I'll just go and apply some aloe vera because it will give that, soothing effect, or apply something to cure it. Definitely doctors come really late on their list. That's really sad, and that's why we are having this session, doctor, so that we can make people aware about it. Now we would like to understand how bad these home remedies could be for urticaria.
See, most of the times, home remedies are not going to cause any harm to the patient. The only thing
Mhm.
is they wouldn't really give any major relief to them because aloe vera cream or aloe vera gels, or even I have heard a lot of patients who come and say that they take the aloe vera from the plant and then apply it on the skin. They
Hmm.
say that it gives some relief, basically. Yes, of course, because it gives a chilling, cooling effect on the skin, and so they do feel some relief, instant relief. But the problem is the urticaria is going to definitely reappear within a couple of hours or a day or two. That's all. So
Okay.
most of the home remedies are not very dangerous until unless I've rarely seen some patients get burns with due to urticaria, because what they did was they applied the onion and garlic juice on the places where they have urticaria, and they
Oh.
put a band-aid on top of it. So that's like a very concentrated juice which can actually cause an allergic reaction and even cause burns on the skin. So other than these very few things, most of the home remedies are very mild. They are pretty safe, just that they don't help much with urticaria.
Right. So as they won't help much with your urticaria, there is no point in wasting your time and energy in
Yes.
home remedies. The best way is to go and consult the right person, a qualified dermatologist, without wasting much time. We would also like to understand, Doctor, as in the beginning, I just said that urticaria can be categorized in acute and chronic urticaria. Please shed some more light about these classifications of urticaria.
Yeah. See, when someone is experiencing urticarial rashes for the first time, or if the symptoms are for less than 6 weeks, then it's known as acute. When someone is having these symptoms for more than 6 weeks, it's known as chronic. Or if someone has had rashes in the past and then they are again experiencing it again now, then again it comes under chronic. So that's how this classification is made.
Mhm. And which one is easy to treat, doctor?
Both are difficult to treat because even acute is not going to really give a instant relief. So in both these conditions the medications will definitely give a good relief. The problem is not about bringing the symptoms under control. The problem is about preventing the recurrence, which is very difficult in both acute and chronic urticaria.
Mhm.
The one advantage with acute urticaria is that if it is say caused due to some chemical or some food item which they are allergic to, and then if we are able to narrow it down and then remove it from the patient's lifestyle, the chances of recurrence are very less. So those patients get a very good result with treatment. But
Mhm.
in most cases it is very difficult, and most of them will have symptoms prolonging for more than 6 weeks, where medications are continued for a couple of months and then gradually tapered off.
Right. And as you said, most of the time the reason is not known or there is no reason, and
Yes.
anything can actually cause urticaria. Now, the thing is that if it can be diagnosed, that what is the cause, what is the trigger, you can avoid it. But if the reason is not known,
Yes.
then what is the, line of treatment?
See, the line of treatment is going to remain the same, whether we know the cause of the urticaria or not. It is just going to help us in preventing the recurrence if we know the cause. If not, it's just going to be that the same medications are going to continue, and the symptoms will gradually come under control. And as I already told you, in most cases, the reason is unknown, or it is without any specific reason that they get. So in these patients, the medications are required to keep the symptoms under control, and no investigation is really going to help them.
Okay. Doctor, what are the potential complications of urticaria if left untreated?
See, in most cases, there is no major complications or anything. It's just that it's a irritating allergy problem where patients are not happy. They don't get a proper sleep. Sometimes they get very irritated, aggressive with other people, family members, or in the working environment. They are not comfortable. They feel drowsy in the morning time. So these are the major problems. Other than that, there is no major complication from leaving it untreated. It is just to make sure that they get a peace of mind, when they get treated, because it gives them more relief, gets a good sleep in the night time.
Right. I've actually seen people who have, isolated themselves. They don't go out, they don't socialize, they don't go to public functions because they have urticaria. And it's quite embarrassing, to keep itching,
Yes.
etc. So, of course, if they go and consult a doctor, a qualified dermatologist, at least they'll get some relief, even if it's not
Yes.
completely cured, but at least the process of treatment, they'll get relief. That's why they should go and do not neglect your condition. If you have urticaria, please go and consult your doctor, because there are chances if they get to know the trigger or what is causing it, then maybe the it won't reappear or recurrence can be controlled. So in any case, you need to go and consult your dermatologist. As you said that urticaria get worse during nights. There can be a number of reasons. One main or major reason is that during the day we are mostly preoccupied, so we get time only during the evening or during the night, and because of the itch, etc., the person is not sleeping, not getting enough rest, and thus his stress level is increasing. Now, is this stress going to aggravate or exaggerate his urticaria even more?
Not exactly, but yes, to some extent, when people get stressed, it can again cause the urticarial symptoms to worsen. So it's more like a vicious cycle.
Mhm. Right. And many people complain that they get very fatigued or tired, because of urticaria. What's the reason behind that, doctor?
Mostly it's because of not getting proper rest in the night time. So since they don't sleep and they are always feeling itchy and most of the time itching, and in the daytime they feel very tired, dull, and fatigued, because of this reason. That's the main problem.
Right. And uh, is there any dietary precautions or do's and don'ts for the patients of urticaria? Because food allergy can or may, cause urticaria. That could be one reason. So, is there any dietary precaution for that?
See, mostly the dietary precaution is only when someone complains about having a urticarial rash every time they eat a particular food item.
Mhm.
If they can, if the patient can really narrow it down to a particular food item, that if they have this particular item and they are developing the rashes immediately after that, then it's better to avoid that. So one way to actually find out if there is any dietary relationship between urticaria and the diet that the patient is taking, what I normally tell my patients is that for the first 2 months I'll ask them to keep a book and note down every day when they get an urticarial reaction, what are the food items they have consumed on that particular day before they got the rash. So once they maintain this book for say 2 months, they get an idea of whenever they get the urticaria rash, what is the common food that they have taken on all those days. Sometimes it does help the patients find out a couple of items which they always see a relationship between having them and then getting the urticaria. But other than that, in most patients it doesn't, there is no major relationship between food and urticaria.
Right. So maintaining a diary for those at
Yes.
least, now having it due to food allergy is going to help. But
Yes.
again, doctor, because many people do know or do understand that a lot of food items causes allergy, like seafoods, eggs, cheese. There can be a number of things. Now, what they do,
Yes.
even if they are not getting urticarial rashes, or even if they are not allergic, or at least they don't know that they are allergic to anything, they'll omit all these things from their thali, or their routine.
Yes.
What's your take on that? How do you take it?
See, normally most of the patients, as you said, they, when they come to me, they would have already gone to a couple of other doctors, or they would have gone to, Ayurveda, Siddha, everything, and then only they come to us. So when they walk in itself, the first thing they say is, I've not been eating non-vegetarian food for the last 6 months, 1 year, or I've not been taking, egg or cauliflowers, and lot of these, even brinjal, which is very commonly associated with urticaria. They saw
Mm,
all these things I have not been eating, but still I get these symptoms. So the first
mm,
thing I tell them is start taking the medications and take a normal diet. Let's see how it is working, and then we will decide. So in most cases, if you see more than 95% of the patients, they come and tell that with the medications, with the normal diet, they are perfectly fine. And then when we gradually start tapering the medicines, they are still able to take a normal diet without any restrictions. There are instances where some patients were really able to narrow it down. Say, for example, one patient was able to clearly say that whenever he consumes chicken, he gets these rashes. So when we tried it again with the same medications, and when he consumed chicken, he got the rashes. But with all the other other food items, he was perfectly normal. So in
mm,
some instances, yes, we can narrow it down, and really helps in avoiding those food items. But in most cases, it's very rare. And the most common food items are mostly like peanuts, egg whites, and these are the most common things which I normally come across patients saying that they get an allergy to. And of course, seafood. A lot of patients are allergic to seafood items, shellfish, and all those things.
mm. Right. And again, in that process, they end up omitting a lot of vitamin or micro or macronutrients from their plates. So it's always good to consult your doctor first and then see what they are suggesting. I'll also take some of our viewers' questions. So Rashika Sain is here asking, I get urticarial rash every alternate day. The rash starts slowly and spreads all over my body, including my head. It is really itchy, big round bumps form. I have to take steroid injections to get rid of this. It's been there since more than 2 years now. I tried all medicine. Is there any permanent treatment?
See, there is no permanent treatment for urticaria, the first thing. Second thing, steroids are not the answer for every urticarial, episode that the patient is developing, because there are a lot of side effects that can actually harm the patient than it can benefit them from urticaria. Regular steroid injections are going to cause problems with the eye, with the weight gain, lot of hormonal issues. So I would rather suggest stop taking steroid injections and rather meet a proper dermatologist or an allergy specialist, work on the medications, try to find the best combination of non-steroidal medications which can help her get rid of the urticarial reactions. Because with this kind of treatment, alternate days steroid injections are not at all safe.
Exactly. So, Rashika, please don't waste any more time. Go and consult a qualified doctor, dermatologist, and get it treated. Avinash Chauhan is here asking, Sir, I have a red spot on my hand. How can I reduce it naturally? Have been diagnosed for chronic urticaria. In a treatment, taking medicines for more than 1 year, also is he's taking medicine for more than 1 year. Itching became a big problem for me. Is there a permanent cure? I think everybody is really, looking for a permanent cure. But
Problem, sure.
yeah, yes, doctor. So, what
See,
will
the
you
first thing is
suggest?
I doubt if it is an urticaria, because urticaria is normally a condition where the rashes come and appear and disappear in different parts of the body.
Mhm.
If a particular rash is appearing just in one part of the hand, and if it is not occurring anywhere else in the body, could be something else, not a. So it's better to get it checked. Probably it is a mild eczema patch or something which is there. And in those cases, there are other things which will really help. Say, for example, if an eczema is developed and there's a red patch on the hand, a moisturizer would be a better option to treat it. So I think if he has not met a dermatologist, it's better to meet someone and then decide on that.
Right. So again, Avinash, you need to meet a dermatologist, get it checked thoroughly. Now, many a times what happens, doctor, because people are so aware these days, they know that there are allergy tests, right? So even before going to the doctor or even before consulting with a doctor or dermatologist in this case, they'll just go to the labs and get the allergy test done. And from there, they come to know that they are allergic maybe to 30 food items or, so many things, and then they are really confused what to do and what not to do. What do you normally suggest? I mean, is it a good thing to go and get a allergy test done by ourselves without consulting any doctor, or we need to first go to the doctor?
See, the allergy test is something that I normally don't recommend even to my urticaria patients,
Mhm.
because if you do the allergy test for any patient, it always comes back positive for at least 10 to 15 different food items, or
Yes.
dust and pollen and other things. And
Mhm.
if you see, in most cases, this would have been positive even if they have no symptoms. So I don't see a major relationship between the testing, allergy panel testing, and the urticarial symptoms. Rather, I would suggest that they can meet a dermatologist, get an IG test, which is basically more perfect indicator of the levels of the allergens in the body. So that gives a better idea of why the symptoms are so severe. And as those values come down, it's better to even reduce or taper the medicines gradually. Allergy testing is done very rarely, particularly when some patients are very eager to know what and all they are allergic to, and then only we recommend it. Or else I normally don't recommend the allergy panel testing for most of my urticarial patients.
So viewers, you first need to go and consult a dermatologist. Don't go by what your friend have done or your family members have done when they have, this thing, the articarial rash, because in their case, the cause may be different. Don't go for over-the-counter medication; it could be really harmful. Don't go for, online influencers, etc, because every person is different. Every person's urticaria could be different because it could be due to different reasons. So please go and consult the right person. Please go and consult a qualified dermatologist. We have Madhumita Agrawal with us asking that okay, so maybe she is having these articarial rashes, but she's not managing or getting the time to go and consult a doctor. Her question is, can these be, life-threatening? I mean, if I'm, getting delayed and going and consulting a doctor, am I really making it worse?
See, in most cases, it's not a problem. Okay, so the only problem is that you're going to be feel very uncomfortable in the evenings or night time. Your sleep might be affected, but it's not safe to always keep postponing it. It's better to get it treated, at least to make sure that it's not serious, because it should not end up in someone having a problem in breathing or anything due to the swelling of the airways because of urticaria, which is then a very severe problem. So as far as it's just on the skin, it's not a major issue if they postpones it, but better to always get it treated at some point.
Okay. So whenever you get the time, please go and consult a doctor, Avantika. Uh, Madhumita, that was. And Avantika is asking, so please let me know what should be the focus of the physical exam for urticaria.
See, in most cases, the physical examination is not at all possible because when the patient walks into the office, they might be completely normal. We can only
Mhm.
know the symptoms of the patient only by the photographs that most patients bring. Because even the patients by themselves, when they come to us, they know that these are not going to be permanent. It just disappears within few hours. So they always take a photograph of the times when they get these rashes and then show me the photos. That's how we actually do the physical examination. It's not that we have to physically examine them in the clinic.
Right. Okay. And doctor, as you said, now food allergies can be one reason. Allergies to medication, etc., could be one. Now, in case of food allergy, normally family members know that okay, one member of my family is having allergy with, say, cashews or seafood, whatever. But in the case of medication, normally the whole family is not aware of, and at least these your friends, etc., they won't know that a particular person is allergic to a certain medication. Now, in case as you're saying many a times, urticaria, in very rare cases, but still it can become complicated, and maybe the person is not able to respond or tell that, see, I'm allergic to this particular medication, so don't give me this particular medication. Maybe he is not in the condition to tell that. Is there a way that the whole family, or whoever is there around the person, is aware that he is allergic to a certain medication or even food items? I mean, can we really do something for that?
See, the only thing we can do is that when the patients are, getting affected due to, say, a medicine, or say they take a tablet for fever, or they take a medication given to them by even say another doctor for some other health issues, and then they develop these rashes immediately after taking the medication, then naturally they would first meet the doctor who prescribed the medicines, and then the doctor will definitely know that they have reacted to these medications. So most doctors will clearly tell them, see, you're allergic to this tablet, make sure you keep a record of this tablet, that you don't take it in future. And there are patients who walk into the clinic when we start writing the prescription. They clearly show us a paper saying that, I've had allergic reaction to these medicines. Please avoid these. So a lot of patients are well aware of that. But the problem happens when some patients take 10 different medicines and then they have reacted to one particular medication. They don't know which one it is. And then they just don't even, follow it up in future. So when in those cases, it is very difficult to know which particular medicine triggered the allergy. Okay. And in those cases, it's just a basis of trial and error. And of course, we have to see if they are getting it with any other medicine. When it comes to food items, normally patients, when they know they are particularly allergic to a particular food item, they avoid it very well. So
Mhm.
that is not a major issue. And of course, even the family members are well aware of the food allergies that the patients are having. So I think mostly it is not a big issue when it comes to food.
Okay. Okay. So we have Abhishek Sinha asking, is urticaria presently treated with medication? And with that, doctor, we would like you to tell us what are the treatment options available for urticaria.
See, in most cases, urticaria can be easily managed with tablets, oral medications. Okay,
Mhm.
the basic anti-allergy medicines, and then of course there are some very new medications which are available for urticaria, which are very safe to take. Okay, like bilastine is one of the oral medication which is very effective nowadays in treating urticaria. So medications wise, you don't have to always go with high-end medications or with steroids to control urticaria. Most of the normal medications are able to give a very good relief to patients.
Okay. And Ankur Sinha is here asking, I have urticaria. It's about 6 weeks that I have it. I was relieved from it, but suddenly it appeared again. So please, I want to know that, am I getting cured or not?
See, this is a very common complaint. There is no permanent solution for urticaria. Definitely, patients will have rebound symptoms now and then. But the thing is, if you are taking a treatment with a particular doctor, always go back to him because he has already managed it well. So definitely they'll be able to, tweak the medicines or change it a little bit so that even if your rebound is there, they can still control it. And this is nothing to worry because all patients will definitely end up with a rebound of urticaria at some point or the other. I've had patients who are as old as 80 years who come with urticarial symptoms, and they have said that in the past they have had these symptoms 30 years ago, 40 years ago, and then it occurs after so many years. So there's nothing to worry.
Okay. And many a times, especially in the case of chronic urticaria, it do happens that patients keep on asking, that you're testing my patients. I mean, how long do I need to have these medicines? So, really, I mean, for how long, especially in the case of chronic urticaria, do you normally prescribe those medicines for them?
See, it's a very difficult question to answer because I have patients who come and meet me once in 6 months also. So what we do is we gradually taper the medicines. First, we give them one medication in the night time. Then we reduce it to alternate days in the night time. Then there are patients who take even just 2 days in a week anti-allergy medicines just to maintain so that they are not getting the symptoms again. I do have some patients who just come once in a year. They just take one tablet weekly just to make sure that the symptoms don't occur. Of course, there can be minor instances where they do feel a little itchy here and there. They might see one or two small wheals or bumps come up here and there. But then these are on those days they just take an extra tablet, just to control the symptoms. But mostly they are very comfortable with even one or two tablets in a week. So there is no permanent solution. But then most of these patients who are on a regular visits, they come once in 6 months or once in a year, and they are pretty much comfortable with it.
Yeah, I think the whole idea is to be comfortable, to have comfort level or relief from whatever urticaria brings along with it. So, Doctor, one more question: is urticaria contagious? Because many times people feel that, especially with skin allergies, they feel that I'll get it from somebody else. What's the case with urticaria?
Urticaria is not at all contagious. Even if a patient, if the kids play with the parent who has urticaria, it's perfectly fine because it's not contagious at all.
Okay. And, in the last 2.5 years, we have got a lot of patients who have complained that they have got hives after they had COVID or, COVID, I mean, caused hives in many patients. What is the correlation, doctor?
See, there is no study to say that there is a relationship between COVID and urticaria. But then, yes, I've not seen as many patients come and complain that they had COVID and then they developed urticaria. But
Mhm.
then I have come across a lot of patients in my practice in the last 1.5 years who came and said that they started getting these symptoms after taking the COVID vaccine. Okay. But we don't know for sure if it is just a coincidence or if it is because of the vaccine. So without a proper study, it is not possible to say if that is because of the vaccine or not. And sometimes the tendency of patients also is to that always when they take a vaccine which they are not very happy with, they tend to relate it to the vaccine. So that is also something we need to look at from the patient's point of view because most patients are not willing to take the vaccine. And once they are forced to take the vaccine, they always relate these allergies to the vaccine. So something which we need to do more study before we can come to a conclusion on that part.
Okay. And any advice for people, especially those who have urticarial conditions? I mean, because many a times, due to ignorance or not being aware of, we commit so many mistakes, which really, prove very, dangerous, especially in terms of treatment. For example, I can keep on ignoring urticaria, or maybe keep on doing home remedies with no use, keep on going for over-the-counter medication or following my friends or family members' prescription who have the same condition and land up in front of a doctor really late. So, what these can lead to? Any advice on that for our viewers?
See, in most cases, it's nothing to worry. Urticaria is a very common allergic condition. Even in most cases, if you're not getting treated, it's fine. It's not going to harm you in any way because there's no progression of it. In some patients, of course, the urticarial rashes might become very irritating. It might cause a lot of sleep disturbance and those things. But then, other than that, it's not a major problem. but avoid self-medicating or taking steroids for urticaria, because those are the problems, things which can actually cause other health issues to the patients. So avoid steroids and self-medications. If it is getting severe or if you feel you need a relief, always you can meet a dermatologist, get a proper medications which are very safe to treat with urticaria, and that should really help you.
Anything else
Yeah.
that you would like to share with our viewers before we sum up the whole session, Doctor?
um, just that don't avoid all the food items, like a lot of patients avoid vegetables, fruits, non-vegetarian items, just because they have urticaria and they just eat curd rice and other things. I've come across so many who come and say I've been eating only curd rice for 1 month, 2 months. So don't do those things, because when you're doing that, you're actually going to cause more damage to your system, because you're actually depriving it of all the vitamins, minerals, and essential vitamins that are required. So always it's safe to consume everything that you like to eat, except maybe if you know that some particular food item is causing the allergy, you can avoid that, but don't avoid everything in toto. And always a doctor can help you with the urticaria. It's nothing difficult to treat, it's very simple to treat.
Thank you so very much, Dr. SENTHIL SIVAPRAKASAM, for your valuable time, sir. It was a very informative session for our viewers, and I'm sure they will use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, at least they now know that instead of self-medication or over-the-counter medication, it's always better to approach a nearby dermatologist. It was great to hear you. Thank you so very much.
Thank you so much for the opportunity.
And viewers, thank you for your participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page all about skin allergy. We are also available on YouTube, Twitter, and Instagram. Thank you. Goodbye.